Dr. Brown. Thank you so much for letting me come on Facebook with you and ask a few more questions. Your videos are always very popular.
Oh, thank you.
You just share such valuable knowledge. Thank you.
My pleasure, definitely.
So, Dr. Brown, I wanted to ask you, what kinds of patients do you see in your office?
Okay, it's an interesting question, Julia. Last week, for example, I had a cerebral palsy patient in from England. That was an interesting one. Severe TMJ disorder. The discs were terribly, terribly damaged. Was non-communicative when I met him. He couldn't speak, couldn't even function. His arms flailed out like this. His legs kicked, so I had to hold him down and keep him sedated all the time. After we put the device in, the first device in, we had the pain actually went away almost completely on him. And he said his first words in about 10 years or 15 years or something like that. It wasn't a lot, just a little bit happening, but the pain subsided tremendously. It's a nice...
That is incredible.
Yeah, that was kind of an interesting case. And then our normal ones are headaches and neck aches and back aches and that type of stuff. And I just kind of recall the cases I see every day. A lot of cranial bone distortions. A lot of these people come to me and they're just all twisted up inside. It's kind of like a jigsaw puzzle. So that's the normal case that we see. I would love it if I could see younger children and help them before the pain kicks in. That's the rough part of what I do. I see them too late.
Yeah. Definitely preventing these things would be amazing. Now, you see Tourette's patients too, right?
Yes, we see many Tourette's patients.
How is Tourette's a TMJ problem, though?
So what's going on? Now, this is a theory that I give credit to Dr. Stack for originating the concept. But what happens is when the articular disc, the disc on top of the jawbone in the joint, is tipped inward, not outward, but inward, the theory is it pinches what's called the auriculotemporal nerve. And that sends the funny signals to the brains to get the twitches, the tics. And so far, decompressing that joint, taking pressure off the joint has worked quite well.
So why do you think it is then that so many people that have these issues see a neurologist first instead of a provider like yourself?
Because pain is associated with going to a neurologist. That's where most people, 99% of the people, will think that's what I'm supposed to do. Unfortunately, they do cover up the pain, but they don't fix anything. And that's the problem we have with it. I guess, honestly, I don't have the manpower to dedicate to marketing the entire concept and beating back the powers that be to get the message out there.
Okay. Well, aside from the split discs that you talked about in the jaw joint, what else would you be looking for and why?
Okay, a good one yesterday, another one in a wheelchair that came in to see me. The massoid bone behind the right ear was terribly sticking out, way out. You could tell that the bones inside the skull were like this, all twisted up internally. When you have that happening, you already know it's a TMJ problem, but secondarily, it's a cranial bone distortion. So if the cranial bones are all twisted up internally like that, that means as I tell our patients, the tubes, the blood vessels, the nerves that are going through this are being crimped. So if someone took a pair of pliers and crimped the wire that goes to your computer, it's not going to work as well, is it? Well, that's what's happening internally with cranial bone distortions. And I just see it every day of the week.
So you see this as common knowledge in your office. Why do you think that so little of this is taught in the medical schools and the dental schools?
It is not taught at all. It's not taught in medical. And in dental schools, in the old days, I always remember my instructor with TMJ said, you take the jaw, you shove it back and up. And that's what they used to teach us at Georgetown Dental School. And in all categories, that is incorrect. It is bad all the way. But it's all they had at the time. Nowadays, I don't see much happening in the TMJ departments either. I've been asked to do a little teaching here and there, and oftentimes politics gets in the way, and we're not able to do what I want to do. So we do one patient at a time. I can see a couple hundred patients a year, and that's all I have time for. And that's how it's going to be until one day we make this thing really, really public.
Yeah, I hear that, from providers that are having success but are nervous to share because they're worried about the repercussions. It's kind of sad.
Yeah, that's a whole other discussion on...
Yeah. Can you tell us a little bit more about the screening protocol that you use for doctors and for dentists?
Yeah, what I do is I offer to my MDs and DDSs and even the osteo doctors, if they want, I can show a very quick screening protocol, which we're actually going to present at the seminar this fall that we're doing. I'm actually going to hand that out, the written copy or the electronic copy, whatever they want. This is a screening protocol that can be done at every single patient visit. The assistant can do it. The hygienist can do it. The physician's assistant, the PA, can do these things. Just a very quick screening tool of range of motion, check a couple of muscles, various observations, and it will only take, 30, 40 seconds for the assistant person to do this, log it in the record. Then you have a record confirming, is there a TMJ problem or not? And that's what we do at our office.
That's awesome. I'm really looking forward to this conference. And, one of the things that moves me is your desire to get this knowledge out there. And in fact, you and I had a conversation after reading an article written by Ken Lieber, who's a patient advocate for TMD. And he's very passionate in expressing his concern about this generation that is suffering so much needlessly. And after we discussed that article, I just want to share with everybody that you strongly encouraged me to drastically reduce the price of the course. And also, if you want to share how you've offered to sponsor the course so that it benefits the attendees, I'll let you share that.
Oh, sure. Thank you. Okay. Well, as I guess all of you probably know, we're heading up a conference in September. And we're bringing in a bunch of the doctors that I work with and a bunch that Julia is aware of. It'll all be put together very, very soon. But for all you folks out there, if you do want to attend, you can, I think you can knock off $300 on the whole thing by the promo code. And they put together something called TMJ Brown, TMJ BROWN as the promo code. And you can get a discount on the whole thing if you want. So that'll help people make it a little more affordable.
Yeah, I think that's amazing, and doing more to get the knowledge out there to as many people as possible. And it's a journey, obviously. This is going to whet their appetite for what's possible, and then, of course, there's so many more learning opportunities to come. So I appreciate you sharing our knowledge.
Oh, we're looking forward to this, yeah. Yeah, we're looking forward to it. I'll be presenting all sorts of the cases that we see, from the simple child, some of the simple kid cases that I really enjoy doing. I get kids sleeping better all the time, and we actually are able to help with sleep apnea issues substantially. So these are the things that we'll be presenting. And of course, the more tougher cases, and I'll talk about Parkinson's a lot too. Unfortunately, it's on the increase, unfortunately. So, yeah, I'm sure.
And I'm looking forward to hearing from one of your patients, share her story about how this has changed her life. Very motivating. I think it's going to be a great event. And again, thank you so much.
Oh, my pleasure. It's what we're trying to do. We're trying to get the word out there. And I just saw Dr. Gene Gregory joined in a moment ago. We're hoping he'll be doing some speaking too. It will be an honor to see him.
Just so that people know, we're going to be bringing in some allied health providers sharing their part of this process, and then everybody associated with your team. So I'm looking forward to seeing the flow of your case studies and how it takes the team to really help these patients. They're difficult cases.
Yeah, there's a lot of difficult cases. I will present the x-rays that I take so you folks can actually see what's going on internally with a lot of these people. And you can see the twisted up bones. I mean, it doesn't take a physician to read what's going on. In fact, we have most of my team members here at the office can pre-screen MRIs and x-rays for me, and I don't even have to spend as much time diagnosing when people send stuff from overseas, for example, and I have to take a quick look at it. The ladies will actually focus in right away. They know what's going on already because they've hung around me for so long.
That's awesome. That's awesome. Okay, well, thanks again for your time, taking the time, and we'll chat again.
Thanks, Julia. My pleasure. Thank you.
Take care.
Take
Okay,
care.
bye-bye.
Bye-bye.